Hello, everyone. I'm Dr. Jim Merlino, the Chief Clinical Transformation Officer at Cleveland Clinic, and thank you for joining us today at the 2020 Medical Innovation Summit. Done slightly different this year because of COVID, obviously all virtual. We're going to do a panel today that the theme of the summit is the future of healthcare digital transformation, and we're going to do a panel today with two amazing industry partners, Clorox Company and United Airlines, on answering the unconventional innovation call. It's kind of interesting when you think about what we're dealing with now. We have decades to study many diseases that we treat patients with across the world. Everything we know about COVID, we've learned in the last 8 to 9 months. We continue to learn every day. Sometimes the information is literally a very short order and it changes nearly daily, but we've learned to adapt, and that really has led to this unconventional innovation. What is also interesting is that, and I think John F. Kennedy said it, in times of crisis, there's incredible opportunity. And I think when the history book is written on COVID, there's not going to be a lot of great things that have said about it. However, a couple of the things will probably be around how companies and organizations are adapting and doing things with greater agility and effectiveness. So today I'm joined by Toby Enqvist, who is the Chief Customer Officer at United Airlines, and Heath Rigsby, who's the Vice President at Clorox. And what I'd like to do is ask each of them to talk a little bit about themselves and their organization, and then we'll get kicked off with the panel. So Toby, why don't you start?
Thank you, Dr. Merlino, and thanks for having us, and nice to see everybody virtually. It's an honor to be here today. But again, my name is Toby. I'm the Chief Customer Officer at United Airlines. What that means is that I have 5 or 6 different divisions, but what we really try to focus on is the customer experience. And exactly like you said, Dr. Merlino, that obviously changed quite a bit after COVID. We were kind of working on what food to add and, improve the seats and, make it smoother, get through an airport. Those are kind of things that we were working on like pre-COVID. And then all of a sudden, COVID happens and I almost feel like that I'm in the medical field in the last, 8 to 10 months here, and I'm learning a lot. But we really appreciate the partnership by both the Cleveland Clinic and Clorox, because we've learned a lot from you guys, and hopefully, the public are seeing the effort that we're putting forth to make sure that travel is as safe as it could possibly be in these times. So thanks for having me.
Absolutely. Heath?
Hi, thanks, Dr. Merlino. And I want to thank the Cleveland Clinic as well as United. It's been a great partnership so far. We couldn't be more excited to be here, and welcome to everybody virtually. My name's Heath Rigsby. I'm our Vice President of our out-of-home division at the Clorox Company. I've been with Clorox for about 19 years. Most recently ran our professional products division, which essentially comprises a building services sort of division, a healthcare division, and a food service division. And most recently, am leading our out-of-home team, which was created in about April, towards the end of April, in response to the COVID crisis. And so what I do is it's a multifunctional team where we look for partnerships and ways that we can bring our company mission to life, which is to create a cleaner world where people can thrive. And this partnership with the Cleveland Clinic and United is our best in class example today. So excited to be here to talk about it.
Terrific. So first of all, you guys should know that even my patients don't call me Dr. Merlino, so just Jim is fine. But the partnership with the three of us really started with United and Clorox. We were late to the party, or late to the wedding, so to speak. Heath, can you touch a little bit about how that got kicked off?
Sure. So the partnership really goes back to March, and late March and early April. And I have to give a lot of credit to United because it seems like a lifetime ago now, March and April, but back then was right when the crisis was hitting in a fairly dramatic way across the country. Everything was shutting down. Of course, we were having our own issues from just simply a supply standpoint, and we were very focused on how do we make more product, because supply was dramatically exceeding our demand. And it was interesting because United reached out to us. It was kind of like I said, late March, early April, and asked about partnering with them on what they could do in terms of their protocols, procedures, technology that we might have, but in general, how could we help them and partner together so that they could put a plan in place as they were looking ahead to getting their planes and passengers to feel safe. And so that's where the partnership was born, and we started talking, working together, and got to an agreement roughly in the early May timeframe. So United was very much on the forefront of trying to get ahead of this and looking ahead to what they wanted to do to make passengers feel safe. And that's how the initial United Clorox partnership started. And then when we came together is when Cleveland Clinic came on board as well, and it's been great.
How's the relationship been for you guys, and how is it being received by your customers?
I think that what we've seen on the customer satisfaction scores is that they're really happy with us. So again, the biggest thing we wanted to do, even though we actually one of the few U.S. airline has a medical director, but we were humble enough that we understood that, hey, this is a total new thing. It's a pandemic that we've never seen before. And we just literally reached out and was on the top of the list, who's the best in disinfection? All right, let's get Clorox and let's get them a call. And the same thing with the Cleveland Clinic. And again, with us having a hub in Cleveland back in the day, we knew a lot of people there and knew a lot about your reputation. And it was the same thing there. We just wanted to talk to the best people that we could get to learn and try to see what can we do to make sure that we provide as safe of a journey as we can and build up confidence in travel. And so again, it's been a humbling experience. And I think to your point earlier, we have changed so much stuff. And I think that probably 90% of what we changed will be with us for a really, really long time. And will probably be for the better, even going forward when we have a vaccine and we're out of this pandemic.
Give United Airlines a lot of credit. You guys are at the forefront of this. I recall when we were brought into the relationship, had the opportunity to review all of your safety protocols around COVID. Our team was impressed by how you guys had thought very specifically about it, as well as the investment you've made. You were the first airline to really put out the call for required masks and enforce it. And that, I think, took a lot of business courage when you consider the controversial nature of some of the things we're asking people to do. How's the feedback been from your customers relative to masking? You talk about an unconventional innovation. Who would have thought one day you'd be requiring, flyers to wear masks?
Yeah. Well, again, there's a small, but very, very loud minority that hates masks, and sadly, some of them have my email. And I'll, if you can see some of the emails, I think I've been called a few things in the book, but to put it in perspective, even in these times, we fly about 130,000 customers a day, and we probably have 1 to 5 customers a day that doesn't really, follow the rules, and so at least without, a reminder. So we've banned around 300 so far, and we try to do it, respectfully, because we don't discriminate against our customers. But if you can't follow the rules and wear a mask and respect the people around you, it's not really wearing a mask. It's not really for yourself. It's for the people around you. We wish you could fly United when this thing is over. But again, to put it all in perspective, the majority of our customers actually really appreciate it. It was a risk because we went first, like you said. There's always a risk when you're first and you're going to get criticized, especially as you remember, mask in the beginning, for some reason, and at least in the United States, was such a political issue rather than a safety issue. So we did get some backlash in the beginning, but I think that we stuck by it. And again, we had your support, and we had other people, expert support, that they was really make a big difference. And we think that we made the right decision for not only for our customers but also for our employees and crew.
Keith, I bet a lot of people that are going to watch this, if they were asked a true or false question, is Clorox the #1 brand in disinfection? They probably would answer true. But I'm guessing a lot of people don't really recognize that you guys are essentially the top brand in disinfection and cleaning. And with managing a brand like that, it carries enormous responsibility, but I'm guessing also opportunity. How have you seen your business change, or the engagement with your company change with other businesses as a result of the pandemic and the focus that people are now putting on disinfection?
Well, we've seen some dramatic changes. I think the obvious change that we've seen is the demand for disinfecting products is very high. Obviously, I think what's been interesting, you mentioned the brand, is that the brand itself. I'm biased, of course, but we do believe we're the #1 disinfecting brand. And at heart, Clorox has always been a health and wellness company because of what our chemistries and technologies can do against various pathogens. The brand itself, though, what we've seen as we've gone through the COVID crisis, is the brand has become much more elevated than even past disinfection. There's been several different polls where the brand has been ranked #1 or #2 as the most trusted brand in the country, up there with things like the U.S. Postal Service, Amazon, FedEx. Brands that have been very integral into delivering things into people's homes as they've been locked down. And what we're trying to do with the brand now is to bring it out into spaces where it typically hasn't played before. So typically the brand has been very strong in people's homes through our normal disinfecting products. And we have a fairly large healthcare space where we work with hospitals such as the Cleveland Clinic and other medical facilities. But now what we're trying to do as the country reopens is how do we use the brand to make people feel safe? So if it's the most trusted brand, we're trying to find ways and partners and places where people who are trying to get back to work, trying to start traveling again, businesses and organizations trying to reopen their business, how do we use that brand and everything that comes with it to make people feel safe, which is really the purpose of the company. So it's bigger than even just the products. It's more about, can I trust what an organization is doing? Can I trust that they're using the right products and the right protocols? And that's what leads us to partnerships like this one, where you bring all of these three things together, a trusted brand like United, that millions of people use their products and their services every day. The trust of Cleveland Clinic and all the expertise and credibility that comes with that. And then the brand with Clorox that people have trusted in their home for 100 years. And you bring all that together and it could create an environment where people, they're willing to come out. They're willing to get back to sort of normal life whenever we get back to normal, whatever that means as we move forward. But we're trying to do our part. And the brand's played a big part of that. So tremendous changes. We've seen tremendous changes in consumer behavior. A lot of behaviors and changes in the way people run their daily lives are probably here to stay, even post the vaccine. And so we're trying to understand from a consumer perspective, how do we fit in their lives? Where does the brand need to be? And how do we create those areas of safety and trust for people?
So, it's interesting because you guys put together a very interesting and robust 6 building blocks for robust cleaning and disinfection. I want to ask you a little bit about that in a minute, because we've done something similar for organizations as well around what are the key tactics that businesses need to do to keep their employees and customers safe. And one of the things that we've been advocating is we've brought into the layperson's conversation is something called the Swiss cheese model, which is well known in the airlines and the military and nuclear power and healthcare. It's we all know that when we're trying to keep people safe, which is our primary directive, we enact processes, we enact cultural fixes, technology processes to try and prevent errors. None of them are perfect. They all have holes in them, like a piece of Swiss cheese, but we know if we line enough processes and tactics up next to each other, that we can create a pretty effective barrier to reduce the risk of getting hurt, regardless of industry or if they're patients. And that's something that we've been really driving to consumers to help them understand why some of these tactics are important and how they can think about utilizing some of these things, not only in their businesses, but also at home. And the 6 building blocks that you guys have assembled, can you talk a little bit about that and the response it's getting and how you're using it with the public?
Sure. So we've gotten great response. I'll start with that, and I'll tell you why we've gotten great responses. If we think about how the pandemic has played out, at least from our point of view, from the Clorox company, initially when it hit, everybody was really bunkering down, for lack of a better term. Right, things were shutting down. They were going home. we saw tremendous business in our normal consumer business, right? This is back when there was no disinfecting wipes on the shelf. There was no toilet paper. There was none of that stuff. You had kind of this run at the grocery stores. It then moved in April and May into much more of a healthcare crisis where you had cases rising. You all saw this as well. And our healthcare business, it shifted much more over to that side of the business of how do we get more product into the healthcare space. Both those things continue to remain. But what we started seeing in May and June as more states tried to start opening was there was not a lot of great information for businesses, or I'll call it public spaces, on what they should go and do. And either they weren't getting enough information or it was information overload. And so what we tried to do, working with the Cleveland Clinic, is to get a simple guide that people could use almost in many different situations. And here's kind of your 6 steps or 6 areas that you should focus on, from education, from risk aversion to protocols. And it's something that anybody could use, and it at least gave them a start to how they should prepare to open their businesses and spaces. And we've gotten great response to that. And it's been brand agnostic. It's been something that, hey, we're just trying to get the right information out to the public so that they can feel safe again. So as they go somewhere, they know that the business or the organization or the places that they're going have taken the proper steps. And for those organizations who may not have a lot of resources, particularly lots of small businesses, to go hire people to go do this, it was an easy guide to go and implement, and at least put some steps in place that they could follow as they prepare to bring their employees and their staff back to work. So we've had a tremendous response so far. We've done something similar for the home. So we started with the businesses, and we've even brought that back into the home, which has been great, so that we can educate people more about how they can make their home safer. Same sort of principles, and have gotten tremendous response from that as well. So, and have appreciated the partnership with the Cleveland Clinic on that.
I think about innovation, the theme of the summit, and all of the work that you guys have done in serial innovations to keep passengers and your crew members safe. I'm going to ask you to just describe some of the things that you've done, but you've done them very quickly. And I know just from what's been going on behind the scenes at United that you've tried things, decided that works, you've executed, you've tried things, decided it doesn't make sense, you kind of pushed it off to the side. As you think about that, I know here at the clinic and in healthcare, for instance, we were doing things very quickly in the pandemic. I mean, one of the things that we were doing, not unique to us, but also common in other organizations, is just crazy stuff like when you have a COVID patient isolated in the ICU and all the doors closed, you lengthen the IV tube so you can control the pumps outside the door. You lengthen the breathing tube so you can control the ventilator outside the door. So some really tactical, low-key innovations that help to keep caregivers safe that you could execute on very quickly, all the way to some of the engineering feats that we've done with others to be able to use one ventilator on 2 patients. Thank goodness we never needed to do that. But it's interesting how things move very quickly. We're constantly just innovating, trying different things to accommodate needs. Can you talk about from the airline's perspective how you guys have thought about that? Some of the things that you've executed on that are really unique that I'm guessing you're finding that customers like them now. It's probably something we'll keep post-pandemic.
Yeah, for sure. And again, here's where the partnership, I think, paid off so much for us. So what we did first, and I love your Swiss cheese example, because that's exactly how we look at safety, both security safety and also flying safety. But now we're doing the same thing with hygiene and sanitation. So we divided each kind of step of the journey, all the way from like leaving your house, check in, through security, either go in a club or a hold room, which is where you take off from the gate, and then on board, of course, and then when you come back, the bag claim area, and then back into a car. So we divided it almost up like that, and we had a team in each kind of step of the journey. And to your point, like exactly what we did, we tested a lot of things, and a lot of innovation out there, and that's where you were helpful. Some stuff didn't work. I mean, we for example, when it came to the electrostatic spraying, which we now do before every single flight, every day. So that's like, almost 2,500 times a day. We tried with drones, early on, and it was really cool. I mean, you see the video of it. I mean, it was really cool, but it didn't really work. It didn't work as well as like that when you do it by hand. So you test, and that's the beauty. It's like we just want to make sure that it works, because like we are, like a lot of businesses, we're 365, 24/7 around the world every day. So it can't only work in a, like kind of like what we say in a pilot setting. It needs to work, around the world. So that's what makes it hard. And again, like anything that we tried, we talked to you and we talked to Clorox, and we got like help. Right now what we're playing around with is a lot of antimicrobial, and we got a lot of input from both the Cleveland Clinic and Clorox on that. We got almost close to 50 airplanes flying around with that, and we're still testing. The results are actually really really encouraging, and it's holding up, and it's actually even more on some of these airplanes. It's actually more better and holds up better than even the electrostatic spraying. So those are the kind of things that we learn, and what we try to do is that we have a saying at the company. It's like, we want to fail, it's okay, but if you just have to fail fast. And when we failed, we just kind of like knocked it up, and we see what we can learn from it, and moved on. And again, we've been doing a lot of UVC lighting, and that's working really well, especially in the cockpit. For our pilots, it's got a lot of equipment, as you guys know, electrical equipment, which is not very good for any kind of type of spray or liquid. So we do UVC there, but we've even taken that further. We know that one place that customers are still very uncomfortable is in our lavatories. So we're playing around, like I said, again, with antimicrobial and UVC lighting cleaning in the labs to try to see is there anything else we can do to make them, as sanitized as they can, and on and on and on. But again, like I think that the point I'm making here is like, without the partnership, that would have been even harder for us, and it would have slowed us down, because we would have had to have longer tests. But instead, we had really, really quick tests. We shared with you guys what we found and got your input, and then we could pretty easily say, okay, this has legs and this could work, and we went for it. Or yeah, this is probably not as good as it could be, and we should probably try something else.
How are your airline workers? It's kind of off topic a little bit, but I am curious. I kind of see flight attendants as the, like frontline healthcare workers, like nurses who are at the forefront of the battle. And I used to fly a lot before I came back to Cleveland Clinic, and I just you watch the interactions that some people have on airlines, and you just think, what are people thinking? And I can only imagine that now, with increased stress, with the requirements that we're putting on people wearing masks, that the job of flight attendants has to be harder today. How are they holding up?
Yeah, great question. I'm actually so unbelievable proud of our flight attendant team. It's one of my teams, and like what the beauty of them, we have over 20,000, and I would say that the majority are just phenomenal people, and they just have this caring side. We have what we call the core four, which is like our basic, ground rules for the company and the culture. And it's safe first, caring number 2, dependable number 3, and efficient number 4. And when the pandemic came, like I said, again, all they asked for is like, make us safe, and then we'll take care of the customers. And they've done a fantastic job caring for our customers, making them feel as safe as they can be, and really, like you said, really being like on the front line and the first responders here. So I'm really proud of them, and it's showing up too. It's not just me blowing smoke here. We are at an all-time high when it comes to our customer satisfaction scores since the pandemic started, and then we even can break it down and on our in-flight scores, which is mainly, again, especially now when we're not serving much, it's really just the service that our great flight attendants are providing, and then that's at an all-time high too. So I do think that people are feeling it, and usually sometimes when crisis happens, you have two different people. You even see the worst of people or the best of people, and hopefully what United has been able to do is show our best side and really care for our customers.
So I want to switch gears and talk a little bit about some of the partnerships that I think we're all forming as a result of COVID. And Heath, I know that you guys have some new partnerships as well that you're companies, organizations that you're working with around cleaning and disinfection. I know for Cleveland Clinic, we're bumping up against 200 businesses that we've talked to or we're providing guidance to. It's kind of interesting from the healthcare perspective. I think we're settling into the management of COVID is not really rocket science, right? We've learned a lot. We're still learning, as I mentioned earlier, but we know there's key tactics that if everybody puts in place, if people are mindful about using them, I think we can keep people safe. I think that's what the healthcare community generally believes. The two things that we found, I think, that most organizations are interested in is interpretation and translation. So there's so much information out there. Some of it's conflicting, misleading, confusing. Scientific organizations just are looking to say, tell me what this means, number one. And then number two, translate it. How do I apply this to my particular business environment or organizational environment so I can, execute clearly and effectively to keep people safe? And I think that's a role a lot of organizations are playing. That's a role that we've played in our business advisory services. That we provide to any business that's interested in having them. We don't charge for this because we see it as part of our community commitment. But from your standpoint at Clorox, how have your partnerships gone, and what types of things are you seeing, or how are you helping businesses or other organizations think about this?
Yeah, so similar to how you think about it, we think about it really in three areas when we talk to different partners. So we think about it in terms of products, protocols, and programs, kind of the three Ps. And when we work with different organizations, each partnership is a little bit unique. Some involve all three of those components, and some may only involve one or two. For example, with United is a great partner because it's all encompassing. They think about it from the passenger's first interaction on the web or on their phone in getting a ticket or looking for flights, all the way through the journey into the end. And that's fantastic because we can work with them and partner with them on what that looks like for that passenger all the way through to create an environment of safety and trust. So many companies or partners that we talk with, sometimes it's about the products, and it's not just about Clorox products, but they actually, as you refer to it, they want that expertise. They may have a question about, should I be using something, or what does this really mean, or how do I read an EPA guideline on what can really be used? And so in some cases, it has nothing to do with actually selling them any product. It's more about just consulting with them on the products that are out there and how they can use them and how they should navigate this world. And then the next is protocols, which is actually how do they go about either using the products or creating the environment that's safe, which gets back to the building blocks and some of the other things. And so with some partnerships, we've done just protocols and product. But the ones that bring it all together really have the three, and the third part's the program. And that is, how do you actually communicate what you're doing out to your customers or your passengers or the general public? And that's where we can bring a lot of expertise. Essentially, it's marketing what the partners are doing, and how do you do that in a way that's educational, provides trust, and provides a sense of folks are going to be safe with wherever they're going or whatever they're doing. And so all of our partners do that in different ways. We're working with different partners in the transportation industry, obviously, lodging industry, entertainment industry, sports industry. And we're seeing some really great results. And I think you're right. People are settling into this is kind of the new world. And so they're trying to figure out, what's my message to my customers on what I'm doing. And that's where we've tried to provide a lot of value within our partnerships. We have some new things that we're working on behind the scenes, where now that we've created a team of partners, that I like to call them, we're looking towards how do we elevate the message out to the general public across all the partners. And there'll be some exciting things in the months ahead of how do we communicate out what all of these great partners are doing in a much more elevated way, to show what they're doing as more and more businesses and people reopen and start traveling and getting out into the world again.
Great. Toby, any thoughts on the partnerships that you're seeing? Particularly, I'm guessing a lot of people don't know. I mean, airlines obviously compete, healthcare competes, but there's a lot of behind the scenes coordination that goes on, and the things that really we don't compete on around like safety for the airlines. And you want to talk a little bit about that and how you guys work together?
Yeah, for sure. I mean, we are obviously a very, very competitive industry, but there's kind of an understanding because what we do each and every day is that we don't compete on safety. And we have a lot of forums, and we actually share best practices and things like that, because what makes if we come up with something that makes us safer, we want to share that so that spreads the whole industry. And that's why, the US airline industry is if not the safest, one of the safest, transportation system in the world. So we want to keep up that. And again, it's just a different type of safety than we've been used to. So we've done a lot of work, and we're actually right now, what's really interesting, we're working with Boeing and DARPA with the US military, and we've actually done many test flights where we've actually kind of tried to calculate what happens if you would have a sneeze or a cough out in an airplane, and just kind of to show that the incredible airflow design of an airplane, it makes it very, very different than pretty much any indoor facility that you have with the airflow, how it's designed to go up and then go down through the floor and out the back through HEPA filters and recirculated air 2 or 3 times a minute. It just makes it to a very, very, very different environment than a normal environment. So anyway, I don't think I'm allowed to say, because the study is not public yet, but it's going to be public here early October. But the early results are very promising, and like the chances of catching something on an airplane with that, seeing at least through our chest, is microscopic. So very, very exciting news. But that's how serious we've been taking it, and we just really, again, together with our partners, are trying to build up confidence in travel, and knowing that people can, because it's so important, right? I mean, like, we all need it in our business, in our daily life. We need it to be safe, and that's really what we're working on.
Yeah, I'm sure there's going to be people that are watching this. They're going to ask the question: is it safe to fly, and can I fly, or should I fly? And I'll just answer and say I have flown twice, actually. I guess I've been on eight airplane rides in the last couple of months. I do think it's safe. I was wearing a mask. Everybody on the plane was wearing a mask. I thought the flight attendants did a great job of enforcing the mask rule. There were no unruly passengers that were complaining. There's a lot of anecdotes around infectivity on planes. We haven't seen a report yet of a person infected by COVID on a domestic plane. That could certainly change tomorrow, but today, to this date, I think that overall we're doing pretty well. A lot of the anecdote reports that have come out, the 2 cases in Europe, are really before the precautions around masking and other things were executed on. So I think we all feel cautiously optimistic that we're doing this right. I want to switch a little bit to the future. So you kind of use the last few minutes of our panel just to allow each one to kind of weigh in on what you think is the future innovation coming for your industry or your company specifically, and how you're going to adapt to that. For healthcare, there's I think 4 really important lessons that we've learned or reestablished. Number one, there's nothing like a good crisis to really accelerate your strategy. So for instance, prior to COVID, we were doing about 3,000 virtual visits a month, and trying to accelerate that. Lots of resistance from patients, from providers. The second month of the pandemic, April, we jumped to 200,000 virtual visits that month. And what we found was actually patients like it and providers like it. And now, we've sustained some of that. So that ability to accelerate critical strategies that are going to drive the business are important. Secondly is coordinating. I mean, we are, to your point, Toby, we've always worked very closely with our competitors around things that we don't compete on around safety. But now we've found new opportunities to communicate and coordinate on things that are important for our communities. For instance, things like the opioid crisis, things about managing social determinants in our neighborhoods. And so I think that's a great benefit. And then the third is I think healthcare has really galvanized its thinking around safety, and putting more investment into safety, putting more investment into thinking of ways to improve care, more quickly, improve more effective care with that kind of spirit of keeping people safe, keeping caregivers safe. And so we're excited about that kind of new reinvigorated North Star to really drive some of our strategies and see where that can take us. Keith, you want to talk a little bit about where you see the future of innovation for Clorox or your industry?
I think there's a few areas, and we've touched on a few of them during our time today, and Toby talked about a few of them, but we talked about from every crisis, there's opportunities. The amount of technology and innovation that we're seeing that's still a little bit behind the scenes is really extraordinary. So technology, I would say in the disinfection space, especially, some technology has advanced or accelerated 5 to 10 years from where it was. So you talk about things like electrostatic technology, you talk about residual disinfection, we talk about air purification. Disinfection is not a new idea. How you do it and the ways that you can do it in are dramatically changing. We talked about UV as well. So all of these technologies that literally 6 months ago might have been either too expensive or unavailable or not commercially viable have been accelerated 5 years in a matter of 5 months. And I think that's very exciting because it's actually going to change the way that businesses and public spaces operate. So I think that's the first thing. We're seeing lots of technology like that, and certainly we're involved in many of those discussions and play in some of those areas as a company. I think probably the second biggest thing is actually in the consumer packaged good world, we would just call it consumer behavior. So consumer behavior, and by that I mean also kind of business protocols, I think are changed for forever after this, right? So we will get past COVID-19. We'll get to a vaccine. We'll get to ways to treat it. I'm very confident and optimistic about that. But I think the ways that businesses operate and public spaces operates are going to be changed for forever. So the days of simply getting just a bucket and mop and sort of cleaning the floors right and kind of wiping it off with a damp cloth, a desk, and everything's going to be okay. I think those days are probably past us. And it's a new way of thinking for how people run and manage their businesses. And most importantly, how do they keep their employees safe and their consumers safe? There's a technology space and there's a behavior space. And so we're rapidly trying to figure out how do we play, and add value in those places.
Great. Toby, where are we going to see the airlines go?
Yeah, so I would say two areas. So number one, I think, and again, you're absolutely right, I think is accelerating because of this is the touchless. So we've been working a lot of like, how can we do more touchless, digital things that we in the past have maybe had, human either contact or self-service, and how can we do that touchless? That's number one. And then number two, and we briefly touched on this before we got on the call, and that's the kind of like the future we're looking at into now. Is there a way that we could test people so we could either like be able to promote and make sure that, hey, everyone who's on this airplane has been tested and are negative for COVID, and on top of that then break down barriers again so people don't have to self-quarantine when they get to wherever they're going. And also it'd be nice, I mean, even if you're just going to visit grandma, it's just pretty nice to be able to know that, okay, I took a test and I flew and nobody on the airplane had it. So I think that will be the future. Obviously, again, we need infrastructure, we need the actual supply of the test, and and price point needs to get lower and some of the stuff. So we're not there yet, but again, we want to lead in that area, and that's kind of like what we're focused on.
Great. Well, just about at the end of the time, is there anything either of you would like to add that we didn't touch on?
I think from my end, I think we touched on a lot of great things. I would just reiterate that I think that this idea of bringing multiple partners together to solve problems is the wave of the future. I think what we've all learned through the past 5 months is no single entity can kind of tackle these types of crises alone. And that's been exciting because as you bring these companies together, they can move much more quicker. And I think we'll be in a much better spot once we get past this than where we might have been with individual companies and organizations kind of operating separately. So that's been very exciting, and I anticipate there'll be a lot more of that, and a lot more benefit to the public to come from it.
Final thought?
Yeah, I just want to again thank everyone. I think I mentioned before. I think that United Airlines is a better airline because of the partnership that we have with both the Cleveland Clinic and the Clorox. I just want to thank you both for the support, and we learned going through this awful pandemic together, and it's just been great to have such partnership and be able to share and learn from each other. And so again, I just want to really thank you, and hopefully it's been as good for you guys as it's been for us. So thank you.
Yeah, it's been an incredible partnership. We're proud and honored to be a part of it, and we likewise have learned a lot from both of you, and look forward to more things we can do together. And Heath, I think you're absolutely right. I think that when you're talking about complicated, big problems, the more diverse organizations that can come together to really put their collective talent to it, there's no limit to what we can do. So I think it's very exciting. Gentlemen, thank you very much for representing United Airlines and the Clorox Company. I think that a lot of good information that we talked about today, and I'm looking forward to the continued partnership and our work together.
Thank you for having us.
Great. Thank you, Jim. Thank you.